Welcome to our show. This is one of your hosts, Jerry Wald. As you know, I'm a stroke survivor, and I do these shows to bring awareness to stroke, TBI, aphasia, brain injury. So I want to introduce our first co-host is Greg Graham, aka AVM Superhero. And Greg will be introducing our panelists, and he'll be sharing what we are going to be talking about. So why don't you guys just sit still, make comments, ask questions. That's what it is all about. We want you guys to ask questions, and we're going to talk about aphasia. So let's go ahead and bring on Greg.
Hey, Jerry, what's going on, sir?
Good, how are you?
I'm well, sir. Thank you for having me again for part two.
Yeah, that's right. We were asked to do this. As far as part two, we got such good response.
Yeah, you know, this is Aphasia Awareness Month, so we have to make sure that we do something for Aphasia Awareness Month to make sure that people understand exactly what aphasia is, and also if they need some guidance to actually help them out after they actually view these actual shows. This is pretty cool.
Absolutely. Hello, Salud, Yvonne from Athens, Greece. Salud, Brad. I love that you guys are here. Kevin Harmer, nice to see you. Please ask questions if you want to know anything, because we have some great panelists. And
yeah, we're gonna switch it up a little bit different today, Jerry. Perfect. And I want the questions to be asked from our audience, but we also want to let our panelists discuss more about their nonprofit organizations, because I think it's very important, Jerry. And you know, we talked about this before, but our audience doesn't understand this yet. I think it's very important that we leave them with, I guess, a door prize. And the door prize is these actual nonprofit organizations that can help them out on day in and day out with their aphasia. Because a lot of times people have aphasia, they don't understand where to go to afterwards. So let's bring in some of the people that we actually have. First, we have a guy. I love him. I know, Jerry, you love him. He's a great friend of ours. His name is Dr. Tom Broussard. He is from Aphasia Nation, a very great guy. How you doing, Dr. Tom Broussard?
How you doing? To see you guys.
Well, sir. Thank you for coming on.
Nice to see you. Good to be seen.
That's right.
So, Dr. Tom, you know, I've been a fan of yours ever since I met you, but you know, a lot of people out there probably they do know you, but some people don't. But you know, what is Aphasia Nation? Why did you make this up, and what is it for? What is it about?
Sure. Yeah, and I'm watching all the people joining, and most of them know who all of us are, and certainly know about the National Aphasia Association, which is sort of the granddad of all. It's 35 years helping people understand about aphasia, have lots of information about aphasia. And I was on their board for 3 years with the National Aphasia Association. But what I ended up doing, and I started this nonprofit a couple of years ago, but just when COVID was starting, so I couldn't do much about it, was one of the things that still needs to be done, and which they don't do at the National Aphasia Association, is really finding out when it comes to aphasia awareness. You know, why is it that most people don't know about aphasia? Why is that? Not you have a stroke, you have aphasia, let's talk about that. How will you get better, etc. Really, how did this happen that there's so few people knowing about aphasia, and it remains that way, right? It's been now several years that they've been doing surveys, and they still have 7-8% are aware about aphasia. Yes, the Bruce Willis a couple months ago, that pumped people up. People learned a lot more about that. I'm sure in the moment for sure, but I need to find out, well, we all need to find out why we have to make this part of our normal language, right? People understand about stroke. Nobody realizes that 30 to 40% of people with stroke get aphasia, right? But nobody knows what that is. And that's what I've been working on for several years, and decided to start what is now called Aphasia Nation, with a new purpose or a different purpose. All of us have lots of different things, and we're all working together. So it's not like me leaving the National Aphasia Association. I still donate to them. I still work with them. They do a lot of work, but Aphasia Nation takes just this other path that nobody has seen before, and that is what's broken in the system, right? And when I started finding that out, then I started looking for how can I fix that. I'll call it broken system. It's not terribly broken as much as it's just never even worked before. And that is about making sure that when people have a stroke at the beginning and their family at the beginning understand that this is a lifelong journey. And along the way, 30 to 40% of those people will also have this thing called aphasia. Not waiting until years go by or months go by and you have left that hospital and then finding out about it. It should start at the very beginning. That's the source. It starts at the hospital. And now, in the recent time, finding out that these hospitals are more and more becoming more sophisticated about strokes, which is always wonderful. They now have these designations, especially the primary and comprehensive stroke centers, which are granted that way. They have to be certified as primary or comprehensive stroke centers. And as I started to do my research, found out that when people are discharged from a stroke, leaving their hospital, they have to have some amount of information when they leave, right? And even if they do provide information, they typically won't provide any information about aphasia. So that's where it starts to break, right? Because if 30 to 40% of your patients leave without knowing that they actually have this disorder and they leave without understanding what that is, that doesn't make any sense, right? So that's what I've been working on. And as I've been talking to the hospitals, then starting to find out that all of these primary and comprehensive stroke centers also have to, by law, have to have stroke coordinators. And there's usually only one. Sometimes there are two stroke coordinators per hospital. It usually depends on how big the hospital is or where it is in the state. And those stroke coordinators actually have tremendous responsibilities because it's in their law, the law of this designation, that they have to talk to the public and to the community about everything about stroke into their future, right?
Hold on, Tom.
Yes.
I'm hearing all this, and I'm glad you're actually breaking it down to the minute type of understanding that we can actually understand it. But so what I'm gathering from you is that with Aphasia Nation and what you're actually doing, you're doing a lot more research, and you actually put in the hospitals in each state, head to the fire, saying, hey, you got to be more mindful about us as people that have strokes, and understanding that majority of the time, aphasia is going to come with someone that has a stroke. So you need to be more aware of it, and you need to educate those stroke survivors and their caregivers. Am I correct with that?
Correct.
Good.
Absolutely. Thank you.
I'm glad you said it, because so people, for you guys to understand, if you want to know more about what Tom is talking about, especially in your hospitals, in your regions, and you want them to be more mindful about aphasia and stroke, Aphasia Nation is a great organization for you to actually join, because Tom is spearheading this particular, venture. He's a trailblazer in this, and he's trying to make sure that each and every one that does have a stroke, make sure that they understand what aphasia is, get tested for aphasia, and also get the proper treatment for aphasia. Am I right with this, Tom?
Absolutely.
Okay, so I'm gonna hold you off for a second, because I know Tom, Dr. Tom, he has so much information. If we just let him go, he'll just go. But we have some more panelists that would like to actually come on here and actually talk about their organization as well. So the next one I have right now, let's bring up Denise Lowell. She is from Just Ask, from Rhode Island. She is a stroke survivor, and she's one of our dear friends too, Jerry. We like her so much. What I have gathered from Denise so far is that she has a stroke and she had aphasia, and in her state of Rhode Island, there wasn't a lot of people actually dealing with this. So she made up this organization called Just Ask that allows stroke survivors and also medical people to actually talk together about aphasia and what kind of resources they can have within that state, and also how you can actually do it within your own state. Am I right with that, Denise? And please correct me if I'm wrong.
Yes, that's how it started. Not by 7 years ago, had my stroke and had aphasia. That was one of the last things that they told my husband when I left. I could walk, and I had more range in my right hand, so I was able to go home. And then after reading all the discharge plans, which Tom and I talk about, is they put a little blurb down there, like one sentence. Oh, yes, she has aphasia, SLP provided, requested, but no information about what it was, what was going to happen. And from there, I couldn't find resources that were meeting my need. People do have some resources, but not enough to help us to follow along the journey. Where are we going now? We did our SLP, we did our 6 months. Where does it go from here? We're not done yet. We still have a lot to do, but without those right directions and resources, we don't know where to go. So Just Ask started their 4th annual aphasia conference 4 years ago so that we could provide those individuals with aphasia, their care partners, and their professionals to go to this conference and give them some resources. And like my biggest thing was in Rhode Island, we do have some great colleges and great hospitals, but the resource is not there. So when we ask, well, maybe if 40 people show up at the library and we can educate 40 people, that would be awesome. We had over 50 and then 100 people attending. So then I knew we were on to it. And we've been able to provide resources throughout the years. This is our 4th annual aphasia conference. And one of the biggest things about what I talk about my nonprofit organization is it's free. We will do all kinds of fundraisers and everything to make it free. We're already struggling with having a stroke. Some of us lost our jobs. We don't have income, and we just need the information so that we continue to be as successful or independent as possible, but without those tools. So this is where the conference started.
So Denise, I'm hearing all this, and I'm in Georgia. Can you help me out here? And is it actually something that you can actually do for us, or is it just for Rhode Island people?
Well, right now our conference has been virtual, so everybody's been able to attend every Saturday in the month in June. We have one more Saturday coming, but we do have a website. So if you didn't attend any of those or you're not registered, go ahead, still register. This is going to be linked to our website after a couple of weeks or maybe a month. We're not tech savvy, but we're learning. So we will have it. We recorded all of those sessions, and you'll be able to review them again at your own leisurely. Again, with aphasia, processing may take me a couple of times to watch that session. So to be able to have access to it on a website and look at it again and again to get the answers you want or questions, that's where it is. So we do have our website. Thank you for posting that, Jerry.
Hey, absolutely. Can I just interrupt one thing? When you had your stroke, because what we're all trying to do is really raise awareness and spread the word about aphasia. Did you know what aphasia was when you had your stroke?
No. And I work with children with all kinds of disabilities. And when I was like, what is this? We don't know. We went to a library, and my husband and I just went through the library and see what kind of books we could have. It was Stroke with Dummies. It was things like that. But you have one little paragraph that said, this is aphasia. And again, the resources just aren't out there. One of the things we were just talking about is, why isn't it common? Why aren't we saying this out in the public? One of the things is we as people have aphasia, take some responsibility for that. We say, oh, I had a stroke, oh, I had a brain injury. And they don't elaborate on that. Well, this is why I have aphasia. Aphasia is the part of the stroke or the brain injury that affects my speech, reading, writing, and comprehension. Not everybody that has a stroke has that, but what do we say, 45% now, Tom? 45% of people that have a stroke, or Yeah, I mean, that's quite a bit of population that is getting that and not being provided that information. And we don't provide that to other people. It's too complicated for us to explain. How can we explain it to other people?
Well, I'm gonna play little
Yeah.
devil's advocate with you on that, Denise, because you're right. We have to, as stroke survivors or people that have aphasia, need to be the people that actually advocated to discuss it. But like how Tom was actually discussing with us earlier, a lot of hospitals don't really test or don't even understand what it is to tell the patient. So they don't even know themselves what they have. So that is the major problem that we have right now, that we need to be us. I'm saying the people that do know, we need to be more be the advocates to actually make sure the whole world understands that aphasia is a problem, and it shouldn't be the stepchild to a stroke. It should be going synonymous. If you had a stroke, let's check for aphasia and what's supposed to be happening if you do have aphasia. But we have one more panelist that's going to be on, and I'd like to introduce her. Her name is Jane Connolly. She has an organization called Heal the Brain. She's a occupational therapist by trade, but she was very disgruntled with how stroke survivors were being treated. And so she made up this new organization called, well, it's not necessarily new, but she made up this organization called Heal the Brain. And it's pretty interesting because I like it because I'm actually a part of it. She has these workshops. She have different survivors speak to other survivors about life after a stroke and actually motivating them to get better. So within her organization, she deals with stroke survivors, people that have aphasia, or anything that has any brain trauma. So I'm gonna allow Jane to actually talk about this a little bit further. Hello, Jane. How you doing?
Thank you. Excuse me, I didn't get, she's my friend.
Oh my gosh. I said
I was
your organization.
waiting for that, Greg, because I was like,
said
oh,
I like your organization. Did I say that? That's one
Yes.
of my favorite. Okay, stop.
Okay,
You're my
that's
friend.
good. That's good. And you're a leader within it, which is so powerful. Hi, Kevin. So okay, my pitch is kind of all over the place, but I guess today I want to explain what we do, but I want to explain where it came from because I'm the only person on the panel who is not a survivor. My dad is a survivor. And when I was working with stroke, I got to be a neurospecialist. So that takes some people, it takes them 5 years to do the training. So you go through school, you get your undergraduate, you get your graduate degree. And then once you're in working, then you have to get more training to be a neurospecialist. And my specific thing is neurodevelopmental treatment. And so I was doing all of that, and it was 2017. I was really pregnant, and my dad had a massive stroke. And he was in a hospital in LA. And luckily, it was a really good hospital. And I remember going down and being in his room in the ICU and, kind of saying goodbye. And we were all waiting there. I have a huge family. So we were taking shifts in the ICU. And then we just waited. Everybody's been there where you're kind of waiting. And you guys sort of talk about how, like, with aphasia, you're not familiar with it. With me, I was familiar with it. I was like, what's going to happen? Is he going to be able to communicate at all? How's this going to look? And I remember I had to write kind of like a dissertation for this neurodevelopmental treatment. And I was writing about somebody who had a left-sided stroke and all of the things that were going to come because of that. So Dad, couldn't speak for a couple of weeks. He had really bad aphasia, and he still has word finding, and he has some expressive aphasia, or I'm sorry, some the other one. But anyway, it was really emotional and it was really hard. And I remember writing him a letter because he couldn't see at first, he couldn't speak, and he was having trouble following directions. Now he's able to walk unassisted. He can read. It has to be like really large print, and he can speak pretty well. But he still does circumlocution, which you guys all know, and that's when say the word is giraffe instead of maybe giraffe isn't coming because you're having some word finding. You'll say long neck animal, spots. And so we still do that. And actually, that's one of the ways that I really kind of, a lot of Heal the Brain is very light and open and comforting. And that's purposeful, because a lot of nonprofits are like, this is stroke, this is how you prevent it. And my focus, and the focus of all of our leaders who are clinicians as well as survivors, is that we bridge that gap between the clinician and the survivor, that we're not working in silos, that we're all together. But the other thing is that we talk about long-term recovery, that it's not about this short-term fix. It's about moving forward and having a whole existence with your disability. So what Heal the Brain turned into, at first it was just a blog, and I would tell my patients, hey, this is your homework, you gotta go read this. And some people liken it to a living, breathing home exercise program. Some people liken it to a master's class for stroke or brain injury in general. And so it's live workshops where you can go and you can learn about aphasia, or you can go and you can work with a personal trainer who's a stroke survivor, who's trained in training people post-stroke. Or you can go and talk to Greg about how to change your mindset. We have all kinds of different workshops, and I could speak to it forever, but it's growing and it's evolving. And the last thing that I'm really excited about is in August, we're going to have our own app. And so you'll be able to just go onto the app, and then on that's where you'll get all of your workshops. You won't have to go into Zoom or anything like that anymore, which, Kevin, you won't have to schedule yourself anymore. That was always the big.
Congratulations.
I know. So we're really excited about that.
So Jane, so is this available to anybody all across the world, or is it just people in the United States?
Yeah, it's mostly people in Canada and the United States. That's I would say all of our members currently, but we have people drop in from, we've had people from Uganda, we've had people from Thailand, we've had people from UK, a lot of people from the UK. And recently we got our video library is up and available. So that's where a lot of our international people live, is in the video library, because they don't have to deal with GMT and all of that. Because it's hard for me to do the time change. So add a brain injury onto that. And then, and also everybody's shaking their heads. Like when I say, okay, we're going to schedule, and I work with a web developer to scheduling, it would take in an OT, if I was working on cognition in an OT, session, I would spend 30 minutes just on scheduling, and making sure that it's low vision, and making sure that you can read it, and then there's all the sequencing that goes into scheduling. And you can have aphasia, and then you could also have problems in another part of your brain with sequencing. They're related, but not the same. So it gets really complicated. But my whole thing, and I think everybody here, is let's simplify, let's use technology, but have a person behind it.
Well, I guess you and Tom are twins, because you guys could take a long time explaining yourself.
Sorry.
But this is what it's all about, everybody.
I got my stroke. I can blame that. Yeah.
What do you blame
around
for
the
me?
barn, but I blame it on my stroke.
But this is what it's about. I really wanted to bring you guys out to actually let the people understand that this is a friendly, nice environment, that there's no bad way of talking, there's no blaming of anything, and nobody's gonna bash you or anything. People are family. We're all family here, and these are the different families that me and Jerry wanted to bring out to you guys, that each one of them have their own special area that they actually can help you out with. So Jane has Heal the Brain, Denise have Just As, and Tom has Aphasia Nation. So I'm very happy that all this is out there for us. But let's go back a little bit more deeper, because I want to hear more from you guys. But I'm gonna give Denise a little bit more airtime, because the two people on top, they was killing Denise's time. But Denise, you know, you was talking about these conferences. What are these conferences all about? You know, I heard you talking about every Saturday that we have these conferences in the month of June. First of all, everybody, June is Aphasia Awareness Month. So if you didn't know that, that's the reason why we're doing this on this month as well. But you know, she has these conferences. Can you talk a little bit more about it? Like who's on there and what kind of topics you guys have?
We had some amazing guest speakers. We had Kelsey Atkinson, who did a presentation about types of aphasia. We also had a local, our title was Aphasia in the Community. How can you get back into your community? So one way to do that is invite people in your community. So we have Ocean State Independent Living Center, who provides tools and resources for people with disabilities. So they were able to provide all kinds of technology and other home accommodations and various of information, which is really valuable. We also had somebody from the Office of the Vet, again, I do have aphasia, DEM, Department of Environmental Management, who showed you how to live in your community, what is available in your area. We have a lot of beaches in our area. Which ones are wheelchair accessible? Can you take a wheelchair out to the ocean? Does this cost me anything? So it was a great information. And then last Saturday, we had Dr. Will Evans from Pittsburgh, University of Pittsburgh, talking about mental health using a type of therapy called ACT, acceptance commitment therapy. So that was really informational. And now we have the last presentation is from Dr. Claudia Wheeler, who is the top doc in Rhode Island. And her title is Putting Words into Action. So again, it's a little bit of information. We divided it up to just Saturday morning so that you have time to digest it, and it's recorded. And if you weren't interested in one, you could just skip it. But it was, and it's in a Zoom format, so it goes around the world. We do have people around the world visiting us during these. But again, we're very busy at this time of June. There's a lot of aphasia awareness programs, but we did record it so you could see it again.
Denise, I have another question for you, and I find this maybe, but between you and Tom might be able to answer this, but I'm gonna direct it to you. I found it disheartening because I had my stroke in the state of Kentucky, and at the time I was on Medicaid, and it wasn't really connected to Georgia, and all my information was really messed up. So they transferred me back to Georgia, and all the help that I had in Kentucky was irrelevant in Georgia, and nobody really know what to do, where to take me. So I know that you made up this Just Ask in Rhode Island. What if I wanted to take all the information that you actually have with your Just Ask and try to correlate it with Georgia? Would it be a streamlined type of thing, or is there certain type of things in each state that I have to be mindful of as a stroke survivor?
Every state is different, so you do need to be mindful. But if you know what you're looking for based on the information we provided about our state, at least you'll have the questions. I know in Rhode Island they do this. Do we have something similar or something like that would be able to help me? So again, giving people the information that they may be able to call it a different thing in a different state. But again, if you're asking the right questions, you might get the answers.
Okay, thank you very much. Now, Tom, I have a question for you. As like I said, it might be general for everybody else, but I really want to draw it to you. I know that you have this passion for this because you go into hospitals and you look at the lexicons and they don't have the word aphasia there. What can I do, Tom, in my state, or actually in my city or at my hospital to get them aware of aphasia and making sure that people understand what it is if they have a diagnosis of a stroke?
The good question. And like you say, everything has to be local. So go to your local hospital. Find out who the stroke coordinator is, depending on what kind of hospital. But if you're there, you're probably a big hospital. So most of them are either primary or comprehensive stroke centers. Find the stroke coordinator and have a meeting. Ask that person, what do you provide at the point of discharge? What do you provide about stroke at the point of discharge to all the patients being discharged? And that would be the start, because the answers will be, we provide nothing, we provide something, here's what we provide, and give it to you. Once you get to look at that, then you can look and see how much is there about aphasia or not. That would be a good first start. And I don't have it here in front of me, but that happened to be what happened. Well, I have it, but it's another table behind me.
Gotcha.
But that's what happened with me when I found a local hospital, found the stroke coordinator, although she found me, because she wanted me to come and talk to the hospital about stroke, because, you know, my title is stroke educator. But I always tell everybody that's what I did, or what I started with, but it's really about aphasia. So she did call me, sent an email, wanted me to come speak about stroke, and it was in May. And I said, I'm happy to do that because it's stroke month, but you know, June is aphasia month. And she said, oh, well, yeah, you can come and talk about aphasia in June too, which I did a couple different times.
Yeah.
And I said, so what do you do at discharge? And she said, oh, we have this great program. She gave me a copy. It's 61 pages, and it's stroke and learning. And I looked it over quickly, and I said, well, I said, do you have much in here? Even before I knew, I said, do you have much in here about aphasia? She goes, I'm not so sure, but I had it with me. So I quickly go through it. On the last page, page 61, there's a short glossary, and there's one line about aphasia. That was it. And I said, well, you know, 30 to 40% of your discharged people have this thing called aphasia, and there's nothing in this book about aphasia. And she goes, basically, she said, wow, never thought about that before. I said, what do you do with the statistics about aphasia in your hospital? She did again. Wow. We have, I think they had 160 factors, what they call factors, everything possible about this person in front of them as a patient. They check off everything, right? It turns out that there's one little on the computer, one little box about aphasia. So if you've been assessed as aphasia at that hospital, they check it off. I said, well, what do you do with that? And she goes, well, we don't do anything with it. She says, even I don't know I know it's in the computer, but I've never manipulated with the data. How many do you have there? How many people were discharged? How many discharged with aphasia? She said, yeah, we're going to have to fix this. So now this all started in March of this year. In March, she said, okay, I'm going to start stripping out that information. By the time we're having a big meeting in August of this year, I'll be the primary speaker talking about this issue. She said, by then she'll have all the data between March and August, because I had told her that the people who are discharged are typically between 25 to 40%. And she said, well, we're not really sure. So we're going to find out. Well, I spoke there a couple of weeks ago, and she said, well, here's what I have so far. She says, yeah, we've had a lot of people with stroke since March. We're saving all that information, and yeah, a lot of them have aphasia. She said, looks like it's gonna be more than 25%, it's more like 30, 40. I said, well, that's in the range, you know. But basically, every time I see her, she is pretty much like, holy mackerel, we don't do anything about aphasia. She realizes that. And that's when I found out from her that it's very important that you have this legally appointed people called stroke coordinators if you were in a certain kind of hospitals. And there's people that haven't gotten accredited yet, but they want to get into that. And at that point, they have to have a stroke coordinator who has a responsibility to communicate with the public, right? About everything about stroke. But even her realizing, but we haven't ever been telling them about aphasia when they leave. And I tell them, since it's a 61-page booklet that they provide, I said, you need to give them, I've said this before, you need to just hand this to them. Hand it to them. You can't redo the wheel. there's no other book like this that is written for people with aphasia and their family at the beginning, with the images, because even if you hand it to me when I had my stroke, I would not have known what it was.
Hold on, Tom, you're putting this up there. This is a book that you actually created. Where can we find this actual book?
Oh, you can get on any of my websites or on Amazon.
Okay. But there's something that you're saying to me, Tom, and I think you're being a little bit coy about this, is that we need to, as advocates, and that's what Aphasia Nation is about, is that advocates get together and actually do our parts and go to those local hospitals and find that out. Even not just for us, but for future stroke survivors, future people that have aphasia, we need to do our part to save them. So like Denise was saying earlier, though, we have to be advocates as people that had aphasia, to be advocates for other people. But people that can speak, if you have aphasia or not, this is something that you could easily do, as Tom was just pointing out, talk to the stroke coordinator and find out what is the pamphlet that you guys have for releasing the people of having strokes. Is aphasia in there? Why not? Why isn't it there? What should be there? Do you have the ABCs of aphasia? Things of that nature. Am I right, Tom?
Right.
Absolutely. So this is what Tom's organization is all about Aphasia Nation. It's not just about him, myself, or anybody else is talking about this stuff. It's about each and every one of us, everybody on this call, to actually do their part, to go to your local hospitals and find out what they actually are doing for people that have aphasia. And I challenge everybody that's actually listening to this to actually go to your local hospital and find out. It doesn't take that hard, take that long, it doesn't take that much effort to actually do it. But if you do that, you can help out so many other people that actually go down this pipeline. All right, now I have a question for you, Jane. Jane, my lovely friend Jane. I'm sorry. Tom got a question. Tom got to go one more question.
Like so much.
Hold on. Tom got one more thing to go. Go ahead, Tom.
Oh, I was just going to say, as you said, if the people go, I don't have everybody's email here as a good example, but they can, from Aphasia Nation, you really can just take a brochure and a 2-page flyer about what a person that's leaving the hospital, a 2-page flyer about the ABCs, so that the hospital themselves, if you hand them that, they can go, oh, okay, we understand this. We can understand why it's so important from a person with stroke who really at the time can't do it. And then on top of that, as Greg was saying, if you can't yet go to the hospital or do other things, one thing you can do is have your license plate done at all your states. There's only 50 states. That means there's only 50 licensed with aphasia. Have it done, because Brad has one of those, of the only 5 so far. 5 states have aphasia. But everywhere you go, somebody sees that aphasia, they're going to start asking questions, and they have no idea. They think it's a new religion or a new country.
Right.
It's true. That happened this morning at the gym. The guy said, I've been watching your car, and I see this thing called aphasia. He says, what is that? I said, you know anything about it? And he said, nope. I said, you know about a stroke? Yep. Turns out he's a judge at the local circuit court right nearby. People know a lot of stuff. It's not like people are ignorant. They just don't know everything in the world. And that's one thing. He actually couldn't believe it. And believe it or not, his father was the president of this hospital where I've been speaking there and working with. And he had no idea. His father himself was the head doctor at that hospital. And of course, his son, now my age, didn't know anything about aphasia.
And
so,
you about 22? Were you 22, 23?
24.
24. Denise, you have something to add before I get back to Jane?
Denise, yeah.
Yes, I like Tom's approach that we need to go out there and advocate, but people with aphasia may not know how to start. So one of the things you can start at is at a stroke support group. Start talking there. At our aphasia, we have our social network group every Monday. This is a great way to network and give people tools so that they can educate people. Because we're in that bubble. We all know this. We're not going to preach to the choir here, but how can we get out to our community? So that's a good way to get it started in your stroke groups and your other support groups. Like, what can we do this month to try to educate somebody? One of the simple things that we do is we just do aphasia rocks. we paint them, we put our sticker on the back of them to say aphasia with a definition or a website. And then people and your walks and things like that, you've educated somebody who wants to go pick up a pretty rock. And it's also therapeutic for people that need to keep themselves busy and to be able to give back to their community.
No, I absolutely love that, because if people have problem communicating, you know, just drawing or painting something just to calm themselves down and everybody can observe it and see it, it's beautiful. I like that idea. You know what, Denise, or actually the whole panel, I didn't even understand what the word aphasia was. I know when I came out the hospital, my voice was immaculate. I had the same voice that I have now. It is remarkable, but that really fooled a lot of people, because I couldn't process things properly. I couldn't read properly. It was very hard for me when I had conversations with people. If they went to a different type of conversation or topic, I was lost. I didn't know how to handle that. So my question, hey guys, everybody, if you do have questions for our panel, please put your questions in these comments. We will actually answer them. Don't feel like we're just hogging up the show. You guys are the actual main stars, main guests. So please ask away. They are willing and able to answer all questions. So please answer your questions in the comment section. But Jane, this is a question I have for you, for more of a medical professional as an occupational therapist. I know for me, I never got tested for aphasia because I had nothing wrong with my voice. But I couldn't read and I couldn't have long conversations with people. It was very troublesome for me. My head would go spinning. What is a thing that a person will have to do in a hospital that makes sure that is a check, not just for speech, but just for your cognitive skills, or not even cognitive skills, but your processing skills, your reading skills and things of that nature? Is there any type of test like that in the hospital settings?
Yes. I think what's difficult is that I kind of talked about that last time, is that the severity of your stroke kind of determines who you get to see. So for example, if you had a pretty severe stroke, then you're going to go to an acute rehab where you live in and do therapy at least 3 hours a day. And there's all of these like levels of what insurance will pay for. And that's where a lot of the cognitive assessments and the speech assessments get done, because you need a little bit more time. When you're in really acute, like in the hospital and just waking up, they're trying to figure out like if it's because of medications, if it's because of just that initial swelling from the brain. So long story long, there are tons and tons and tons of tests. Mostly speech pathologists do the tests for like specific aphasia. Occupational therapists will also do cognitive tests for like your receptive aphasia. And there's things that nurses do, and physiatrists and all the myriad of doctors and people do. I think the problem is that there are a lot of people who fall through the gaps based on their insurance and based on their like level of severity. So if you're in the middle of severity, like you can walk and move, sometimes you don't get the same care as if you were like in a coma for 2 weeks and then had to go to acute rehab. And not all acute rehabs are created equal.
So that troubles me, because what I'm hearing is based on a person's insurance is how they will get actual treated and tested, and they could be sent back out into society without the proper care or proper diagnosis. I know one woman that from New York. She was a young lady. She's probably about 23, 24 years old. But after she had her stroke, they just sent her out of the hospital without anybody taking her out of the hospital, discharging her. And she said she slept outside in the rain after she had her stroke. So there's a lot, because it was a lack of insurance. And
this is particularly a problem with young people who have strokes. And young people having strokes is on the rise. I think that I read that it's, I'll get that article for you, but I think there's 30% more since 2007. So not everybody has aphasia of that group, but the disorientation that you have post-stroke that's universal. So that's just like really bad care. But I think that there's no like protocol for everybody, and there's such a lack of education across the board that if you're not in a specialized stroke hospital, you might not get good care.
Okay. Now, Jerry, I want to put this back to you because you've been pretty quiet over there, but I want you to actually answer this because I think there's a very major misconception with people that has aphasia, especially when it comes to speaking. A lot of times people think that you have aphasia, that you're not intelligent, and your intelligence is gone. So they'll try to mistreat you and things of that nature. How do you deal with that when people look at you without the patience or thinking that you're not that same person with the intelligence you had before your stroke?
And good question, Greg. I actually run across this quite a bit, and I can tell right away when someone's looking at me, and I can tell that I'm not explaining it correctly how it should be explained. They look at me, and I can feel like I just got to get out of this situation because it's tough when you, especially at nighttime. It gets a little tougher because you get a little more tired, and your speech, like right now, is kind of a little difficult for me. But I just deal with it. I've been doing this for coming up in 12 years when I had my stroke. So it's I talk to people every single day in the stroke community, and it's a little difficult, but I just deal with it. I don't let it bother me. Nothing, someone just said that I never get depressed or anything like that. But we have our moments, and that's just part of having a brain injury. But what I have been doing before, and I know that Tom, you and I have talked about this. I go about three times a month to stroke support groups in person. And lately, I have been asking, just because of Tom, who is the stroke coordinator? And one of my speech pathologists said, I am. But when I look it up, there's no stroke coordinator in there. She just said, well, I'm the only one that took it upon me to start a stroke support group. So I get the emails. I just assumed that she was the one that was doing that. So I now asked and said, I need to find out who the stroke coordinator is. And this is a stroke and heart hospital. It's a big conglomerate. They don't have one. And Tom's even saying that legally they have to have it. Now maybe are they just getting to that? Because I can't find it. But I go to all these and I bring my little PowerPoint presentation and I talk to them and let them know, they're mostly either new stroke survivors or they're just want to go to a stroke support group because they're feeling down. So I let them know that, things do get better. There's a rocky road, but, because I've been told within the first year that I have plateaued. This is it. This is about the best you're going to be. I know this is like the worst. It's a sin. So I don't agree upon that because since day one, I've really recovered. I'm still recovering. I know I'm rewiring this whole brain of mine because I've lost thousands of miles. Well, I gotta put you up here. I can't see it. Let's see.
What is that, Tom?
Plateau.
It's coming out blurry. Illusions of
just because Jerry was talking about the plateau, I just was putting up the image of the plateau.
Thank you, Deborah, for this. What? Unbelievable. I just had to throw that out there to give myself a little credit, okay?
No, but Jerry, this is a very interesting thing that we have to really acknowledge because the word that comes to my mind is when people do have aphasia is that they feel like they're inadequate. And that is a thing that a lot of society is actually putting on them, that actually they are inadequate when they're really not. It's just that people don't have patience. And we have to discuss how this patience, because I'm bringing this up because I'm I do a lot of segues. I am what's called a leader in one of Heal the Brain workshops. I do this thing called ability over disability. And there's a lot of people in my workshops that don't feel adequate enough to be in part of society. They might have brain trauma, they might have aphasia, things of that nature. But in that particular group, I try to reinforce that they are adequate. There's these stories that they have inside their heads that other people has put inside their heads, saying that they're not part of a society that wants them, or they're less than society. But that's completely incorrect. So I'm saying that because there is places for people to actually understand who you are, to listen to you, to have patience for you, and to make you grow into a person that you want to become, instead of saying that everybody's against me and you have nowhere to go. There's places like Heal the Brain. They have conferences that's like Just Ask. They have medical professionals that actually talks about what you could do if you want to roll your wheelchair up to the beach, to the sand, to the ocean, things like that. And also you have places like Aphasia Nation that talks about helping us out even when we're not even asking for it. They go into the hospitals and talking to the stroke coordinators to make sure that all this information about aphasia is actually distributed to the caregivers as well as the stroke survivors. So this is great stuff, and I'm glad that you said what you said, Jerry, that you actually have learned that, no, I'm not inadequate. You're inadequate. You don't understand that my brain works functioning well, and everybody else needs to have more patience with me because I know what I'm talking about. Just give me a second, right?
Yeah. And another thing too, people what really helps me is talking to somebody that has a brain injury, somebody that like I would say communities, all these stroke communities. It really helps me out a lot, because if I'm and my family understands, but when I have out in the conversation with a lot of people, I want to concentrate on one little conversation, and things are like eating away at all these other conversations. I just have to kind of walk away. But let's see. Can I?
I cannot read any of it.
I know that you want to answer something.
Why?
Somebody's talking? Was somebody talking?
I don't hear anything, but I did hear that. But
Actually, that was me. I was writing a note saying that I cannot read, and I have an accommodation called a reader. So as I was typing that to you to make sure I was typing the right question to you, it reads to me, and I didn't mute myself. So I have.
Hold on, Jerry. That's an interesting thing. So I don't know if the people know that there are actually readers out there for people that do have a problem reading. They have these different things out there that can actually help you out. As Denise was just typing away, it was writing out. It was actually saying the words that she was typing out, so making sure that she clearly understands what she's writing. But before with that thought, I have a question that Jane wants to answer about left side of the strokes. So let's let Jane answer that, and I'm gonna get back to you, Jerry.
Yeah.
I think it was from Heather Flanagan, but they were asking if aphasia is only if you've had a left-sided stroke, so right affected. So like Broca's aphasia and Wernicke's aphasia, the expressive and receptive, those are in that area. But it's kind of confusing because you could have a concussion, which is a mild traumatic brain injury, and still have aphasia. You can have a major traumatic brain injury and have aphasia. You could have a brain tumor and you can have aphasia. And those aren't necessarily in those areas. So we're still really discovering more about the brain and why we're having this crossover. And there are certain populations of people who have, there are offshoots of people who have a right-sided stroke, so left affected, who have aphasia. More commonly, when you are right-sided, right stroke, left affected, you have what's called dysarthria, which is when you can't form, it's more motor control. So your mouth isn't working quite as well. Your tongue isn't working quite as well. It's really common to have both for the first 3 months, 6 months, 9 months of your recovery, actually. So like a lot of people, that's another reason why aphasia, I think, gets put on the back burner, is because a lot of people come in and maybe they can't swallow. And so that's critical, right? We have to be able to eat. So they work on the dysarthria and the swallowing problems. And then they hopefully you don't discharge before they can get you to the right person. And one other thing I was thinking of is if you are really aphasic and you can't go into to talk to a stroke meeting, you can email the stroke coordinator, but also the discharge team. So that's another way that I know some really great people in our programs who really have no expressive language, but are beautiful writers. So that's another way to get in.
That is true. That is true.
Yeah.
I have a question that I want to ask each and every one of you, but there's one question I wanted Tom to actually dibble or dabble with a little bit, because Mike seemed like he had something about what we was talking about going to the hospitals. He's a little bit dismayed. Jerry, can you bring that question back up, or that comment back up about Mike? He said he contacted some 20 local hospitals.
Absolutely.
Yeah, Tom, this might be something that in your wheelhouse. You might want to connect with Mike and see what you guys can do to make this happen, to make this a better situation for these hospitals.
Yeah, that's a good comment. Even before walking into the hospital and asking for a stroke coordinator, one of the things you can do is go to the search box on their website and put in the word aphasia, because that word is looking for aphasia anywhere in their website. I say many, I haven't done enough of a scientific study, but I have done upwards of 100 hospitals. When I say many, I'm talking 60, 70, 80% do not use the word aphasia at all. So that's sort of the first tip about aphasia. But some of the more interesting things too is that it's not just the hospital community, it's really the wider public, because I've also been looking at other large, huge nonprofit in the country, looking also if they know anything about aphasia. And I am finding some very interesting things where they also have the same issue. Since they don't know about it, it is called the invisible disease for a good reason.
Mm-hmm.
So they don't know about it. So when asked about that, they'll say, well, it's nowhere in the website. We really don't know much about it at all. So anyway, it is a worldwide problem in terms of just awareness, and we have to get to the source. But that's what we're all about, is trying to figure this out so it doesn't become 6 or 7% 20 years from now about awareness.
I thank you for that, Tom. And like I said, you might want to hook up with Mike and see if you guys can actually deal, with a proper protocol of actually doing that, to actually talk to these hospitals and things of that nature. That's pretty cool. Who wants to tackle this one right here from Heather?
What's that one?
Oops.
I see two hands. Who wants to take it? Who wants to take it? Who wants to take it? Denise or Jane? Come on, give me a hand back again. One more time. Who wants it? All right, go ahead.
Read it to me and I'll tell you if I can answer. Because my reader does not read on your
Okay, so I had a ceiling problem. I had a massive stroke 15 months ago. I am left side affected. I don't have aphasia, but in the early days, but put me on special diet, a soft diet, because I have trouble swallowing.
I am not a doctor, and this is not my area for tea.
We'll give that to Jane then.
There you go.
So that's really common, because for some people, breathing is really hard in the first days after a stroke. So, you might be intubated and then have to come out and learn how to breathe. So you also have to learn how to swallow. And so they do fluoroscopies, which is like an x-ray, but then they put fluid down, and then you can actually see where the person is not quite swallowing the right way. And then they teach those muscles with little electrodes how to swallow. So it's a real process, and it's a hard thing. So you might be on like a feeding tube for a bit, and then you have to graduate from that to a soft diet. I mean, people go through all kinds of things. And that is more of a dysarthria thing. So, because it's more like muscles and your brain not being able to tell your muscles, even if they're involuntary ones, what to do.
So Jane, you brought up something pretty interesting, because if a person has that problem with swallowing, they really don't deal with the aphasia part, because that is more important because they need you to swallow instead of worrying about you speaking or comprehending actually words. Am I right with that? Is that the protocol that actually happens?
That is the protocol that actually happens. And I think that, it's unfortunate because I think a lot of times people want to do more. I would want to do more, and then it's like, okay, they're on to the next place. They're on to the next place. There's not enough time to dig into some of the things that you want to. So a lot of times I would just create a packet and hand it to the caregiver. But you're so overwhelmed at that point too. I know I said this in our last talk, but this is something that someone said to me like a couple of years ago, and I think about it all the time, that you get your best education in your first 2 years of stroke life when you can't remember anything.
Right.
And that's not just from the stroke, it's from the emotional toll of many things: not being able to swallow, not being able to speak, not being able to walk, not being able to breathe. So I think everything that we're doing to educate people about all of this myriad of symptoms is so good.
All right, so we have this one last question, and we're going to close this off pretty soon. But I want to answer this question from, and please do not beat me if I say your name wrong. Salud.
Yes.
I want Denise to take this one. Here's a question, Denise. It said, I met a young lady while I was in New Braunfels, Texas, and I asked her if she knew about aphasia. She said yes. Turns out she suffered from migraines since she was 11 years old, and because of her migraines, she was diagnosed with aphasia. Is that something that you hear a lot within your support groups, that people that have migraines, they automatically get diagnosed with aphasia?
It is so amazing how many people have aphasia due to other type of medical issues, whether it was a virus or they have migraines, whether it's just traumatic, not just, but if you had brain injury, concussions, it is so limited as the resource that they're getting. And like we just said, Tom says that there's no data collection of that. So even if that person did have migraine situation and they end up with aphasia, somebody had a concussion, that data is not being collected. So it's really hard to be able to address it if you're not sure what you're addressing and how much is needed. Again, it goes back to funding, education, and again, one of the things I've heard is that because there's no medication for aphasia, it sometimes gets to the back burner.
I just wanted to add to that too. I think that if you have, I'm sure you've experienced this, but if you have aphasia from something else, there's shame to it, and so it's underreported. So there's mild aphasia, moderate aphasia, severe aphasia, and there's ways to qualify that. But what I've learned is sometimes I'll be working with someone for like 6 months, and then they'll really pause, and I'll be like, oh, that's not processing. That's aphasia. So there are these like little diagnostic differences, but they take a long time to parse out. And I think for people with seizures, for people with migraines, like you were saying, any kind of brain stuff, I think there's a lot of shame with it, so they don't report it.
The other population that is getting a lot of attention, but not as much as they need, is a lot of the military men coming home, women with PTSD, other type of injuries, and these are the type of population that don't speak up. They're too proud. They're embarrassed. They don't want to tell people, I can't read anymore, or I can't speak like I used to. And they'll say, oh, he's just so silent since he came home, or he's just this when he came home. And it may be associated to aphasia, but it's not actually being addressed.
Absolutely. So, since we're just over an hour, are there any other last words before we all have to say goodbye? Any last words? First of all, I appreciate all of you being here. It really it really helps out. Some of these comments have been really, really amazing, and thank you for being here. So first of all, Greg, AVM superhero, I appreciate it. Denise Lowell, just asked, I really appreciate you too. And I appreciate Dr. Bassard, I really do appreciate it. And Jamie Connolly,
And
thank
Jane.
you so much. And your friend. We are all
Yeah,
friends.
she's my friend. My friend Jay.
Yeah, yes. How many friends do you have?
I have a lot of friends. I have a lot of friends. You're my twin.
That's right, I'm your brother. I'm
my
not your
brother.
friend, I'm your brother.
Yes.
Twins.
Well,
It was great.
I
Thank
appreciate
you.
it.
Thank you for inviting me. I'm glad to be able to provide the resources I have. And like I said, you can always do a support group with me. You can do a care partner group with us and the conference. There's a lot of resources and I'm willing to help with everybody. Just let me know what you need and I'll see what I can do.
Perfect. And my email, I put it in the thing. So if anybody needs it, because I know like Mike knows Megan, for Tom, he wants to help out, but if anybody else wants to help out, mine is talkstroke@gmail.com. So if anybody needs help, want to help out with all these organizations,
Yes,
reach out.
please reach out to Jerry, and Jerry would give out the information to whoever needs to get it within our panel. So please feel free, don't be shy. We want to help out. We want to be able to help out the aphasia community. This is what we do. This is why we're here. This is why we did this show. We're not doing it for ourselves. We're doing it for you. We want to make sure that everybody is accounted for and everybody's spoken for.
Great. That was great. I appreciate it. Have a great, and thank you guys all for commenting and being here and making it successful. Thank you guys.
Thank
Bye.
you.
Thanks a lot.